Okay, everybody, thank you so much for joining us today as we talk through how to cover one of the major issues in healthcare, and that is how to help your patients cover their out-of-pocket healthcare expenses and how this can benefit your hospital by lowering your bad debt expense and improving revenue, but also by helping drive better patient care and patient satisfaction. Okay, let's get started. All right, I'm sure we've seen the headlines here. They have been in the media for decades now, but have really become front and center in the last 2 years. Between Black Lives Matter movements and the COVID pandemic, the inequities in healthcare have become really big news, and all evidence seems to point to the fact that the lower your income, the more difficult it is for you to be able to afford healthcare. Your patients are worried about medical debt, even those with health insurance, even those with middle income type paying jobs. People are so fearful of the potential out-of-pocket costs and the fear that they cannot afford care that they either don't seek it, or when they do, they can't afford the treatments or medication costs. This graphic in the lower left-hand part of the slide here shows that 29% of lower income patients or people cannot afford medical care. Now, lower income here is considered to be $47,100. I know a lot of school teachers who wouldn't consider themselves to be lower income, but are under that threshold of $47,100. So 29% of those are unlikely to be able to afford their out-of-pocket medical costs. Let's start by understanding why even patients with health insurance are having trouble affording medical care. So insurance companies, in a way to keep premiums as low as possible so that their members can afford health insurance, have shifted the burden to their members in other ways. And that is by increasing deductibles, co-insurance, and out-of-network provider costs. So in the last decade, annual out-of-pocket costs for healthcare have more than doubled. And to put this in perspective of income, average incomes have increased by about 15%. So what that means is the burden on lower and middle income patients is reaching points that are making it almost impossible for them to avoid medical debt for seeking, sometimes even basic care. So we will move on to patient consequences next, but for all of you financial people on the call, let's try to understand what this means for your hospital and your profits. In 2020, hospitals saw a 47% increase in bad debt and uncompensated care, which is fueled by the fact that as healthcare costs rise and patient responsibilities increase, only about 20% of your patients will actually pay the bills that you send them. One of the things that we're going to get into is how there are ways to pre-identify these patients and help them cover costs through alternate payment sources, particularly across some key disease states that tend to have some of the more expensive care costs. So this means that through some key programs and tactics, you can help your patients find sources of funding that result in their bills being paid and your hospital not sending them over to collections agencies. The consequences of all of this is that patients and hospitals face a few options which under current hospital strategies lead to unsatisfactory outcomes for both themselves and your patients. So option one, medical bills are not paid by the patient, the charges are written off to bad debt, and patients are sent to collections, and their credit scores are impacted. Option two, patients are choosing not to receive treatment, thereby impacting their health, their ability to work, along with their family's financial welfare, and the overall impact that this can have on their community. And then you have consequences of this, which are that a hospital doesn't meet its broader responsibility, which combines both patient care with profits, and it becomes particularly more impactful in a value-based care environment, and patient satisfaction scores suffer due to the direct correlation between financial experience and overall patient care and patient experience. Let's dive into our first example here, and that is GBMC Healthcare in Baltimore, Maryland. We started working with GBMC's Cancer Center originally, but this has now expanded into the GI Infusion Center, the specialty pharmacy, neurology, infectious disease, and GI specialties. However, with this example, I will walk through the infusion centres, including cancer and GI, as the impacts here were the most significant. Each day, we look at the infusion centres and clinic schedules and have built a report that allows us to look at each of the patients that are coming in. We look at their treatment, their diagnosis, their insurance, their deductibles and copay responsibilities, which are all factors that will determine what kind of funding we are able to seek. We identify any patients that have had past bills that we can help with or who are expected to have upcoming out-of-pocket expenses, and notify a designated member of the GBMC team who then speaks to the patient and tells them about the help that can be provided, and then has them give our team sign permission to seek all available financial assistance on their behalf. The initial screen that we do allows us to identify what kind of help that we can source for the patients. For commercial patients of all income levels, we will always look for copay cards. These are low-hanging fruit for getting assistance, but unfortunately, the reimbursement process can be difficult, but we'll discuss this more on the next slide. We are also aware of each of the open disease foundations that might be able to help and the eligibility and qualification levels of patient assistance programs. In many cases, we are able to help patients not only cover their out-of-pocket costs, but using some foundations or funds, we can also help them cover their insurance premiums, which they really appreciate. Some of you may know that while funds exist for a range of diseases, many of them are closed to new applications and they will spontaneously open at times. One thing we do have at Q Consulting is a proprietary solution that scans all disease foundation websites, and as soon as a fund opens, we are notified and have a wait list of patients in our database that are eligible, which means that we can immediately sign them up for help. Funds for things like breast and colon cancer may only be open for 30 minutes, so we have to move really quickly to get as much help as we can for as many patients as we can. We use the information from the patient's medical record and signed permission form, which was provided to us, to apply for assistance. This way, we don't need to bother the patient or the clinical staff with questions. Once we're able to secure the funding for the patient, we contact them and explain what help we were able to get and the process of having us manage the submission of each of the bills to the funding or copay programs on behalf of our client, GBMC. We may occasionally need another piece or two of information, so we'll request that at this time as well. We also give them our phone number and make sure they know that we are always available and willing to help. Okay, moving on to getting paid. This is probably the most difficult and time-consuming part, and a lot of the reasons why these types of programs haven't helped as many patients as they were designed to, despite their best intentions. Each program will have different requirements for what is needed to submit for payments. They all require EOBs. Some require forms called UB4s, and others have certain specific forms for each and every bill that you submit. When you think about all of this in the context of a patient who is undergoing chemo and might be trying to also manage all of these bills and submissions on top of that, it isn't tough to work out why it just falls into their too high basket. Each week, our software runs the EOBs through a portal that the client has. Common ones here that GBMC might be using is Availity and Aurora. We check on the 200 or so patients that we're actively managing, and the software will generate an EOB for anyone that has received one in the prior week. We then submit that EOB along with all of the other required information to each and every program for each of the patients that there was an EOB for, and then we follow up and confirm that the payer received the information. Then it comes down to chasing the money. Now, most organizations that we work with are really great at turning around payments pretty quickly, but there are a few out there that are really difficult and take a really long time, and we may actually have to follow up over the course of a few months before they process anything. So throughout this time, in those cases, we're in constant communication with the billing department and also the patient, making sure that the billing department doesn't send the bill to collections before the payment is received. Payments can usually be made in several ways. Some companies will load a credit card, like a copay card, and in those cases, we work with the hospital's billing team and have them process that. Others will send a check, and in these cases, we get a record of each of the check numbers and provide these to the billing team so that they can apply them against the patient's account. We are really proud of the outcomes that were achieved at GBMC's Cancer and Infusion Centre over the course of 18 months. These include a 70% reduction in bad debt. A lot of this came from copay cards that helped cover relatively small amounts, things like $2,500 of a deductible or $5,000 that a lot of the commercially insured patients typically face. And really being able to clean these up made a big difference to the bad debt report. Disease funds were used to cover a lot of the Medicare patients when they were available, and when they weren't available, we used free drug programs. In relation to the improvement in financial performance with our services, we were able to achieve about $80,000 in additional revenue per prescriber. There are around 10 of them at this practice, which includes nurse practitioners, so approximately $800,000 annually in additional revenue. We were also able to secure free drug at the rate of around $300,000 per prescriber. Now, while this doesn't directly benefit the financial performance of the Cancer Centre through additional revenue, it does reduce patient bad debt, which the patients really appreciate, but it also reduces a lot of the efforts that the billing team was having in trying to collect these patients' payments or send the patients to collections agencies. There was an additional $20,000 per prescriber for other things that were able to help patients. These included premium assistance programs, urgent need programs. These are just things for $100 or $200 that help patients cover some urgent costs, as well as travel programs. Staff are thrilled because they see happy patients. The billing staff are relieved from chasing down patients for payments, and patients are elated that they can now focus on their wellness and getting better versus their financial obligations. The next example is from a small client in a rural part of Texas who was seeing a lot of patients facing outstanding bills that they couldn't afford to pay related to their COVID treatments. Our client here is a small critical access hospital that was seeing a lot of their COVID patients struggling to afford care. So with our help, we were able to identify a fund that would assist these patients earning under 400% of the federal poverty level with up to $3,000 to cover their medical bills and their insurance premiums. You can see from the table below that a family of 4 earning $106,000 per year would be eligible for these funds. And when you put this in the context of what a dual income house of maybe 2 nurses or police or teachers might earn, most would actually fall under this level. So far, we've helped over 250 patients with these funds, including many of the staff members at the hospital who contracted COVID and were able to use this money to cover their medical bills and then use any leftover funds to help pay their insurance premiums. Our final example here is how we help ACOs and value-based care focused groups help your patients with medication and treatment compliance, as well as their outcomes, which, again, for those of you who are part of an ACO or who are focused on value-based care metrics, know is vitally important to success. This next example is how we help a lot of Medicare patients afford their medications. The average Medicare patient has around $7,000 annually in out-of-pocket costs related to medication and prescription expenses. And one of the more common medications that many of them with heart conditions are on is Eliquis. This costs on average around $500 per month, which for a lot of retirees is a huge financial burden. We are able to look at a patient's medical record and their prescriptions and identify, based upon their insurance, who might be eligible for a program that can help cover these medications or help these patients with their costs. Sometimes we might be referred to by a physician or nurse after a patient has mentioned the expense of their prescription. So really it can work both ways. But with some basic information from a patient, we can usually determine what we can help with, and our support team will gather information like household income and the amount spent on drug costs annually, as well as other medical expenses, and then we can apply for assistance on the patient's behalf. In this case, it was a 74-year-old lady whose household income was $52,000. She was married, both of them were retired, and the cost of Eliquis on top of all of her other medical costs was causing a lot of financial stress. We were able to sign the patient up for a patient assistance program that not only provides her with medication for free, but also ships it to her house monthly to ensure that she receives it, and her providers, with the security of knowing that she continues to take her medication, believe that this will really help her patient compliance improve and ultimately help her outcomes improve. And of course, as in all of our prior examples, patients are generally thrilled with the help, and this is reflected broadly in patient satisfaction scores. Here are some examples of comments that patients have made after we've been able to help them. The top left-hand corner here, a father was just thrilled and told one of our support staff that we've only been speaking for 8 minutes, but I think you're going to be my new best friend after we helped his 26-year-old son cover some infusion costs. And up here, a nurse at a breast cancer center was so happy that we were able to help one of the patients that had really, lackluster insurance, and she was looking at very, very expensive out-of-pocket costs. These are the kinds of things that patients say to us all the time, and at the end of the day, it makes our jobs very rewarding to be able to help them, and at the same time, help our hospital clients help these patients cover these costs. Okay, here is a little about us and how we can help. We are a full-service support services firm. We partner with hospitals, specialty pharmacies, infusion centers, cancer specialists, as well as a range of other specialists across all aspects of support services, starting with things as simple as insurance verification through to more complicated prior authorizations, and of course what we discussed through this presentation, which is financial assistance for patients. We work side by side with the patient, with their clinicians and family members, and manage each and every requirement needed to qualify and receive financial assistance to help your patients manage their medical costs. Well, that is the presentation for today. We hope you found it helpful. Please feel free to answer the survey questions that should pop up after the presentation ends here if you would like a copy of the slide deck. In the meantime, here are my contact details if you would like to reach out. And thank you for joining us today. We hope to see you on some of our future webinars.